Okay, so I have a little bit of an update, but first I want to recap a little bit. My name's Crystal, 52 years old, and I have a recent diagnosis of lupus. Since then, I've been placed on medication, and it hasn't had time to actually reach a therapeutic level or anything yet. But recently, I was hospitalized, like I told you before. Mine is affecting my neurological system. And I was recently hospitalized, just an overnight stay, so they could run tests and check my heart because I was having heaviness in my chest, and my blood pressure was all over the place. Pulse was all over the place. But when I would rest or lie down, the heaviness wouldn't completely subside, but it would ease up a little bit. But they admitted me in the hospital because they checked my troponin level, and my levels went from 6 to 19, which has never happened before. I've had the heaviness in my chest before, but it's never affected my troponin level. So after a stress test, chemical-induced stress test, and an ultrasound, EKG, there was no permanent damage to my heart, but it is attacking my heart. And I feel like it's my central nervous system that's attacking the autonomic part of my body. But I'm not a doctor, so after that, I saw my rheumatologist and let her know everything, and she said that's very rare for lupus to do that, especially initially. But I have to see a neurologist and I have to see a cardiologist next week. So I just wanted to stress the importance of having the proper testing. When I was the first rheumatologist I went to, she did the standard test. And the only thing on my blood work that was elevated was the ANA and the dsDNA criteria. And she told me that since my C3, C4, inflammatory markers, SED rate, all that was normal, that I didn't have an autoimmune disorder. But the second one I went to, which is the one I go to now, the rheumatologist, she did what is called AVISE CTD testing. AVISE. I know I keep spelling that, but I do it because my southern accent's very thick, and I want to make sure that you understand what test I'm talking about. I'm aware of my accent, but I wanted to stress the importance of that test so you can get that done, even if your other labs are okay. If you have an elevated ANA, and some other symptoms, they can go ahead and run that test. As long as you have some kind of criteria that would warrant further investigation, they will run that test. Now, it only tests for connective tissue diseases. You'll have to Google it and look what all it tests for. It does not test for MS or anything like that. But you can ask for that if you feel like you have those symptoms. And I just wanted to stress the importance of that because I don't know where this is going, but trying to get a diagnosis, I feel like it's in my neurological system. This lupus is attacking my central nervous system. That's just my opinion. I don't know. It seems to be. But it hasn't caused permanent damage yet. But if it's left not treated, it will, because there's only so much you can work a muscle before it wears it out. And, your kidneys, your heart, your lungs, they're all muscles. And I just want to stress the importance of getting that diagnosis before it causes permanent damage by way of your central nervous system or otherwise. Again, that testing is AVISE CTD, AVISE. It's a journey. We'll get there, though. I'll talk to y'all later.